you are eating well and exercising, but your weight won't budge, this video is for you. This is not because food and exercise do not work, they do. But chronic stress has a way of changing how your body responds to those habits. And when your body finally responds, the progress feels harder than it should. I'm Dr. Hade. In this video, I'm going to be explaining how chronic stress affects metabolism and weight. And more importantly, what actually makes your body to start responding to those healthy habits. This is not about blaming cortisol, it's about supporting the body so food, exercise, and sleep can do their jobs. We are often taught that weight regulation is mainly about calories, food choices, and discipline. No doubt those factors matter, but they are not the entire physiological picture. From a physiological perspective, weight regulation depends heavily on hormonal and nervous system balance. You can eat perfectly, but if your body is under constant stress, it behaves very differently. Now let's talk about cortisol, the body's main stress hormone. In short-term stress, cortisol is helpful. It is essential for survival. But research consistently shows that chronic elevation of cortisol, which is often linked to ongoing work stress, sleep deprivation, and emotional strain, has very different metabolic effects. Prolonged cortisol elevation has been shown to raise blood glucose, increase insulin demand, promote fat storage around the abdomen, which is known as visceral fat, and disrupt normal appetite regulation. And multiple studies show that this increase in central fat can occur even without changes in calorie intake. And this matters because visceral fat is not just stored up energy, it is metabolically active and closely linked to insulin resistance and cardiovascular risk. So over time, this changes how the body handles energy. One of the most important downstream effects of chronic stress is its impact on insulin sensitivity. Insulin is the hormone that allows glucose to move from your blood into the cells to provide you with energy. Research shows that prolonged exposure to stress hormone reduces how responsive cells are to insulin. So what happens? The glucose then stays longer in the bloodstream, insulin levels remain higher for longer, and glucose clearance from the blood becomes less efficient, and fat storage, particularly around the abdomen, becomes easier. This is why under chronic stress, weight loss can become slower and more resistant, even when diet and activity are appropriate. At that point, traditional calorie restriction often becomes ineffective or even counterproductive. This is why people under chronic stress often feel stuck in their weight loss journey. They cut calories further, they exercise more, but the body interprets this as additional stress. From a physiological standpoint, the body is known to prioritize survival, not fat loss. This doesn't mean healthy habits are ineffective. It means the body's response depends on the physiological environment they are working in. I want to be very clear here. Stress is not an excuse to abandon healthy eating or movement. It's a signal to support the body more comprehensively. Once we understand how chronic stress affects metabolism, the next step is knowing how to support the body practically and safely. So, how do we support metabolic health in the presence of stress? Firstly, by supporting the nervous system. Chronic stress keeps the nervous system in a heightened state of alert. When this becomes the default, cortisol then remains elevated, sleep quality suffers, and metabolic regulation becomes less efficient. The goal here is not to eliminate stress, that's unrealistic, but to reduce constant activation and create regular signals of safety. This can be achieved by practicing simple repeated actions. like slow walking, breathing exercise, and reducing constant stimulation. All this helps shift the nervous system out of survival mode. And over time, this supports cortisol regulation and also improve how the body responds to healthy habits. Secondly, nutrition. Nutrition still matters deeply, especially under stress. During chronic stress, irregular eating and extreme dietary restrictions can destabilize the blood glucose and further stimulate cortisol release. When blood glucose is more stable, the stress response becomes quieter and metabolic signals function more effectively. Finally, for now, sleep. Sleep is one of the most powerful and underestimated regulators of metabolic health. Inadequate sleep increases cortisol levels, worsens insulin sensitivity, and disrupts hunger and fullness hormones. Even short-term sleep deprivation has been shown to impair glucose metabolism. And supporting consistent and restorative sleep improves stress regulation and allows healthy behaviors to work as intended. From a medical perspective, sleep is not optional, it is a treatment. Regular meals with adequate protein help stabilize blood sugar, reduce excessive insulin spikes, and support appetite regulation. This doesn't mean eating perfectly, it means avoiding extremes, particularly when the body is already under pressure. So, when stress regulation, nutrition, movement, and sleep are addressed together, metabolic health improves more reliably. Healthy behaviors don't lose their value, they become more effective. If this resonates with you, this is not a lack of discipline, it's the body responding to sustained pressure. And with the right support, that response can change.